We'd like to begin this podcast by acknowledging the traditional owners of the land on which we meet today, the Whadjuk Noongar people, and pay our respects to elders past, present and emerging. Mel, here we are again. How are you?
Good. How are you?
I'm great. We're talking couch potatoes, episode 37.
37.
That's
God.
Extraordinary, isn't
It's
it?
getting close to 40, isn't it?
Yeah.
I feel that dread like I did when I was 37 years old.
Well, remember how excited we were when we turned 21?
I know.
And now we're like, oh, we're hitting 40 soon. And we don't want to live, do we, really? This is the thing. We have a fatalistic desire to not exist, this podcast, because it's not necessary.
Exactly,
So,
100%.
Yeah. We've got a good one this week, Mel.
A lovely doctor.
Oh, my goodness.
She's
doctor?
a veterinary.
She's
doctor of veterinary medicine.
Emergency vet.
Yep.
And I didn't even know emergency vets existed. I just thought it was a vet open during the day. You take them down when they've got a tick or something. No, of course, animals have emergencies. And she deals with it.
Yeah. You have to be extra special, I think. Not only of the work that you have to tackle, but also the emotional side of it. Must be next level.
And I got to have a little bit of a chat with her outside the podcast, and her heart is really in it. She's super smart, but also she's super compassionate. And we know that there's vets that work in the racing industry, for instance, and we're a bit curious about how you can have that sort of conflict of interest working in an industry that really hurts and kills dogs. And I'm really keen to hear what she's got to say about that.
Yep, absolutely.
What else is going on, Mel? What's happening in Free the Hounds world? What sort of stuff can people get into?
Okay, so in the world of Free the Hounds,
Yeah.
we are selling our tickets now for Nana Bingo. It's going to be such a fun night. Please get your tickets before they're sold out. Head to Humanitix, or you can find them on a link to it on any of our social media platforms.
Already done.
Very good. And I hope everybody is getting their walkers ready. Shine them up. Put your cardigans on. Best lippy, because we want to see as many people dressed up as Nana and Pops.
All right, I'll get my best lippy out.
Yep. Yeah, well. And there will be prizes for the best dressed Nana and Pops at the event. It's going to be a lot of fun. The other thing that we have got to look out for everybody is the 5th and 6th of April. We are at the Vegan Expo, which is always a really nice weekend event just to be with nice people. I know the vegans get a tough time sometimes, and whether you agree with it or not, at the basis of it, they are nice people.
Yeah, those bloody vegans wanting to not exploit animals.
I know.
You know, wanting to protect the animals. And
it's calm, it's relaxed. There's no pissed bogans. It's just...
There might be some bogan vegans, Mel.
There might be, but they're not pissed. And they're not annoying. And they're not giving us a hard time just because we don't agree with them. Yeah, look for us there.
Alrighty. Yeah, I'll come along to that one. Jem is a dyed-in-the-wool vegan.
Yep.
Breaks the rule that vegans aren't annoying people, but she's got a heart.
Jem's gorgeous.
What else, Mel? Anything else?
That's it.
That's it for now. Well, let's get on with the main part of the show, because I'm really keen to talk to Dr. Olga.
Yep.
Having chatted with her before, she is so knowledgeable, so well-spoken. The antithesis of me, really.
With a veterinary degree.
Let's get into it, eh?
Okay.
All right, Mel, here we go. We've got a wonderful guest with us today. We have Dr. Olga, who's an emergency vet, and she's been doing that since 2017. Not only that, she's got her own little rescue family, 3 foster-file cats, a clumsy Cavalier King Charles, and my favourite, of course, a senior greyhound called Charlie. How are you, Olga? It's lovely to have you with us.
I'm great. It's great to be here. I'm really excited to be talking to you guys today.
Hi, Olga. Thank you so much.
Awesome. I want to ask, before we get into the questions, we chatted a little bit about Charlie, and he's got a really unique story. Charlie, he was down to be euthanized because he had such bad dental damage, and you stepped in and rescued him at a very senior age. Can you tell us a little bit about that?
Yeah, I was contacted by Friends of the Hound. So they're a fantastic rescue group based in Queensland. So what had happened is Charlie was brought in by, I believe it was his trainer. He had such severe dental disease that at that point, the vet said, look, we're at a fork in the road. We've got to make a decision. The dental disease is so bad that we either must proceed with a dental under anesthesia, or given that this is affecting the dog's welfare so much, you need to consider euthanasia. And that's when the owner or trainer said, look, I'm not prepared to pay for this. I'd rather euthanize the dog. The dog, Charlie, was otherwise in good health. There was absolutely nothing else wrong with him. Bloods were completely normal. So thankfully, the vet contacted friends of the hound, who then contacted me. He had his dental procedure. Everything went really well. He did need a whopping, I think, 16 or 17 teeth out, which is a huge amount.
Poor boy.
Quite a prolonged recovery, long anaesthetic, painful dental disease. And once he recovered from that procedure, he came to us and he's been with us ever since. So about 18 months now, and he's fit in absolutely wonderfully. He's just such a beautiful dog.
That's awesome.
That's gorgeous. And sorry, just to ask you on the dental disease with greyhounds, is that something that's sort of relevant to the breed, or is it possibly due to improper care while they're in the industry?
Yes, definitely a combination of both. So greyhounds are definitely one of the breeds that are predisposed to dental disease, but at the same time, it's ultimately up to an owner or trainer to look after their animal, and looking after their animal involves proper dental care. It's not difficult to maintain dental health. If you get your dog, or if the trainer was getting their dog checked once every 6 months, had an appropriate dental plan, it wouldn't have gotten to the point where Charlie's teeth were essentially rotting out of his mouth. He had infection everywhere. It was absolutely horrendous. So definitely a combination of both, but a complete neglect on the owner's behalf, letting the teeth get that bad that a vet's telling you, hey, you need to make a decision. You either euthanize, which thankfully the vet convinced this owner not to, or you need to be prepared to spend X amount and get the teeth looked after properly. Yeah.
It's a hard one, isn't it? My girl is 10 and she has got all her teeth, which I can tell you the anxiety of trying to clean those choppers every other day is way less than watching her go into the vet clinic or going under anaesthetic at that age. So I can really vouch for the maintenance route.
100%. And I don't think people realize that if you ever get a toothache, if you get a minor toothache, you're going to go straight to the dentist, whereas you can imagine a dog's got a mouthful of rotting teeth. That is so painful. And owners will say, oh, no, they're still eating and drinking. They're fine. We don't need to address their teeth. But dogs and cats, dogs in particular, are really good at hiding pain. And you can't use that as a factor to say, look, I'm not going to bother with the teeth. I'm going to wait till they rot out of the dog's mouth. It's absolutely unacceptable.
Yeah, when I was in rescue, one of the vet reports said that they could smell the dog's dental disease across the room. And I guess that's something that we find with the vets on track, and not to talk about your colleagues in a bad way, but it's something that we don't understand why this isn't picked up by the on-track vets, because the controlling bodies are very particular in saying that all dogs get vetted before and after races. If that's the case, then I would have thought that a lot more dental disease would be picked up early.
Yeah, that's a tricky one. I think because the teeth themselves are not going to prevent a dog from running. Again, I don't know the ins and outs of, I guess, greyhound vets on the track, but if it's not going to immediately affect this dog's ability to run, then I'm just not quite sure whether or not that's something that would be only looked at. Exactly.
And kudos to you, Olga, for mentioned back in episode 33 with Betho that these older dogs, they really are vulnerable and they need a home. So thanks for stepping up for that.
Oh, the oldies are my favourite. I love the old crusty dogs. That's
She didn't mean that, Charlie. You're not crusty.
No. Just got a salt and pepper little grey face.
That's what Jim says about me. She loves my crusty old dog. You work in emergency veterinary care. I imagine that's quite a full-on sort of profession to have. What led you to it, Olga?
Yeah, so I think most kids have a dream that I want to be a vet, and that dream essentially stuck with me. I ended up initially starting as a kennel hand at a vet clinic, and then I progressed to being a nurse at an emergency vet hospital, and essentially I never looked back. As soon as I graduated, I did general practice for a couple of months and then realised emergency was definitely my calling. So I've been in emergency since 2017, and I absolutely love it. It's definitely difficult. It's not for everyone. You've got to have really thick skin. You've got to be used to seeing owners that are pretty much going through the worst time that they possibly could, and all the emotions that come with that. But being able to be there to support those owners and really do everything that we can to get those animals through I'm just so passionate about.
And working in the field, what are the most common sort of health issues that you see in rescue greyhounds? Some of the unique medical and behavioural stuff you see?
Yeah, of course. So if we start with sort of your fundamentals with medical issues. So some people might know, if you do have a greyhound, that greyhounds have a much higher blood count as opposed to normal dogs. So if you think of a normal dog, their blood count in terms of a percentage, you're looking at roughly about 37 to 55%. whereas greyhounds actually sit at about 50 to 65%, so a much higher blood count, which is going to be quite important anytime you take your dog in. They get bloods done. It's really important for the vet to be aware of that. They also make exceptional blood donors. Most greyhounds are actually universal donors, so we call it DEA negative, which is the universal donor. And because they have such a high blood count and the most compatible blood, they make really good blood donors. So my 2 previous greyhounds that we lost in 2021 before they became unwell, they were active blood donors at the clinic that I worked at. So it was just so heartwarming that they could actually give blood to potentially save other dogs' lives. So that's one sort of quirky thing about greyhounds. In terms of medical issues, there are a couple. So number one, some of you guys might be familiar with pannus. So essentially it's an eye condition that can be secondary to UV light exposure, but can also be an autoimmune disease. So it's something that we see quite commonly. Otherwise, and this is exactly what we lost our 2 dogs to back in 2021, unfortunately, greyhounds are predisposed to a condition called osteosarcoma. So it's a very aggressive bone cancer. And we unfortunately went through this with both our previous greyhounds, Tyson and Missy, and they were diagnosed tragically within 6 months of each other. So that was pretty emotional to go through, and that was in the thick of COVID. So it was an emotional roller coaster. So that's definitely a big one that I'm sure most greyhound owners are quite terrified of. And I'm happy to chat about that a bit more, about my experience as an owner and as a vet, if you guys are wanting to.
Yeah, I lost my girl to it in August as well. So she was just playing outside, and the next thing, broke her right foreleg, and we took her straight to the emergency vet, and they found osteo in there. So we just took her home and made her comfortable for 24 hours. Gave her all the treats that we could, and then she left us at home with the cats around her and our other dog and me and the kids. It
was a tough time.
Yeah, it's awful. So, please share anything you can on osteo for our listeners. That'd be great.
Yeah, so first doggo was Missy. Missy, she was around 9 at the time of diagnosis, and she had a similar experience to what you're describing. She jumped out of the car, and the next day she pulled up quite lame. I managed her at home with some anti-inflammatories and then thought, okay, she's not getting any better. Took her to work with me. We did x-rays and saw that there was a fracture surrounded by this moth-eaten appearance to the bone. So what osteosarcoma does is it starts to eat away at the bone, and it causes the bone to be very fragile. So simple activities like jumping in and out of the car, even doing zoomies, can actually cause a fracture. And that's often how these cancers are picked up. So it's a really aggressive bone cancer. In terms of treatment options, because the long-term prognosis isn't great, you can imagine it's a big decision to make as to which way to go. So the most tricky thing about an osteosarcoma, or the most difficult thing for the dog in itself, is the pain. And without amputation, that pain is going to be persistent. And you can give medication after medication, but it will get to a point where the dog cannot tolerate that level of pain. So amputation is definitely a palliative measure. A lot of owners are quite terrified of amputation, and having gone through it myself with Missy, who had a front leg amputation, which was actually a lot trickier than a back leg. And then our second dog, Tyson, who was about 10 at the time of diagnosis, we ended up doing a back leg amputation because otherwise they were in good health. They were still eating and drinking. And otherwise we could see that, look, let's give it a go, even though we knew it could only give us, or it may only give us, a couple of months. With Missy, in terms of the diagnostic steps, once you are suspicious of an osteosarcoma, if you're going to do the full staging, which means looking for evidence of spread of the cancer to help guide your decision as to whether or not you would proceed with things like surgery and chemotherapy, what we did is she had a CT scan under general anesthesia, because a CT scan is the most sensitive method to pick up spread of the cancer to the lungs. So she had that done. Her chest was clear. Her abdomen was clear. And we thought, all right, we're going to give it a go. We're going to put her through surgery, and she's going to have the amputation. And if it comes back as a confirmed osteosarcoma, then we're going to do chemotherapy and see how she goes. She lasted about 8 months, which it's very different for every owner. For one person, 8 months, no, I'm not going to put my dog through. That is not long enough. I'm not comfortable with that, which is completely understandable. Whereas for someone else, they might say, I just want 2 months. And you really have to know your dog, because you've also got to think about patient factors. Is my dog going to tolerate this? Are they going to be okay being in hospital? And there's no right or wrong decision. Every dog is unique and different. So she tolerated the chemotherapy really well. And at that sort of 8-month mark, she declined quite rapidly. And we said, look, she's gone through everything. She's been a really happy dog until now, and it was time to say goodbye. So that was her journey. With Tyson, our second greyhound, he actually had evidence of spread of the cancer already at the time of diagnosis. Because we had already went through osteosarcoma with our dog Missy, we thought, look, if it only gives us 1 or 2 months, we're still going to do it. And he ended up going 7 months. So he definitely went a lot longer than we all expected. We did hydrotherapy, we did acupuncture, we did everything just to keep him as comfortable as possible. And then he also had a quite rapid decline at that 8-month mark, and we said goodbye. So every dog's journey is going to be very unique. Every owner's journey is going to be very unique. And as an owner, you will, obviously in conjunction with having a chat to your vet, you will know whether or not putting a dog through amputation and chemotherapy is going to be the right thing. But I find a lot of owners immediately off the bat say, no, we're not going to consider amputation. There's no way in hell. But having gone through it myself, the initial couple of weeks, yes, 100% it's difficult. But once you've eliminated that pain and they've actually recovered from the surgery, a dog on 3 legs, like Tyson did zoomies on a farm. He was the happiest dog, and it was so endearing and just overwhelming for us. We were so happy to see him so happy. So I think, again, every dog's journey is different. There's no right or wrong. It's a really emotional thing for any sort of family to go through. But yeah, that was our experience.
Yeah.
Wow.
My girl, unfortunately, it hadn't spread, which was brilliant, but she had 2 toes missing from the foot of her left leg. And she's a big girl. She was 35 kilos. So they said it was probably going to be very difficult for her. And she hated the vet. Like it was something that she
That's the thing.
And I thought we just couldn't put her through it. She would have been so upset at going through that, like you say, you know your dog and you know what your dog's capable of, I think. So
100%. If you have a dog that you know is going to have a poor recovery, they're miserable in hospital, they're not going to be okay with going to the vet weekly for chemotherapy treatments, that sort of thing, then absolutely. Then you've got to say, no, enough is enough. We're not going to do that. We're not going to allow my dog to get miserable just because we want X amount of time extra. And you're ultimately going to make the right decision as an owner. You know your dog best. As vets, we can say, these are your options. You've got X, Y, Z. This is the prognosis. But you're the one that knows your dog best. We as vets don't spend the time at home with your dogs. So whatever decision that an owner makes is ultimately going to be the right one. And there's never a wrong or right. It's such a tricky thing.
Yeah, absolutely. Do you know if there's, I guess, to do with the racing and the osteosarcoma, or possibly the breeding of it through the lines or the carrying of it through genetics? When a dog is having repeated injuries, even if they're small fractures or hairline fractures, things like that aren't necessarily picked up on those bones, is that going to cause osteosarcoma possibly more quickly? Is there anything around that? Because Free the Hounds are looking at those dogs that have died from osteosarcoma, asking our followers to let us know to see which sires it is mainly that seem to be sires of the dogs that have died. Do you have any information around any of that, or is there just nothing that's sort of factual enough to rely on yet?
Yeah, so I don't think we have enough information as of yet. I think it would definitely be a really interesting study to look at retrospectively and try and trace things back. But at the same time, with the greyhound industry being relatively, I wouldn't necessarily say secretive if that's the right word, but it might be quite difficult to get medical records, and a lot of these things are potentially not documented. So I think I would absolutely love to see all the data on this. I don't think there's a direct link at the moment. I wouldn't be surprised if, let's say, in 5 or 10 years, we do note that there is some sort of correlation, but there's just not enough evidence, or I guess no current studies that have come out and said, look, yep, we found a direct link between A and B. Yeah, there's just not enough information at the moment, but I think it would be really interesting to get that data and review it.
Yeah, I don't think there would have been a cohort large enough until probably the last 5 years of greyhounds alive post-racing, because so many were euthanized. Once they finished racing, they were just killed, so we wouldn't have any idea how many actually had osteo.
Exactly. You wouldn't have seen senior greyhounds back then because they weren't alive. That's the thing. And now that people have them as pets, you're actually seeing sort of the progression of the disease and that sort of thing. So, yeah, it's a really interesting topic. So, but I don't think we have enough data,
Olga, you mentioned earlier about the pain that greyhounds can go through. That might be missed, actually. It might be overlooked or misunderstood. Do you have any sort of advice for what kind of signs adopters should look out for? How can they ensure their greyhound is comfortable? How can they sort of pay attention to some underlying pain that might not be noticeable?
Yeah, of course. So there are a couple of different things that I think are quite easy to miss. So first of all, dental pain. Just because your dog's eating it doesn't mean that they're not in pain. But obvious signs would be, let's say, a dog that originally eats a dry food or something that's quite abrasive on the teeth, and then them being a little bit resistant to that, wanting you to soften the food, those sorts of things. So that's a fairly sort of obvious one. Otherwise, being slower to eat, being a little bit more reluctant to eat. Even if you raise your dog's lip and actually have a look at the teeth, if you see any sort of inflammation of the gums, so you'll see really swollen gums, you'll see gingivitis, which is inflammation of the gums, and you'll see quite a red line or a redness to the gums, and smelly breath. That's a huge one. That at that point, if you can smell bad breath, then the disease is actually quite severe. So there's sort of some clues that you can use to figure out if potentially there's an issue. And then if you're concerned, definitely get your dogs booked in with a vet. In terms of things like arthritic pain, especially as they head into their senior years, a lot of owners just put it down to, oh, they're getting older. But I have a much more preventative approach that I'd much rather intervene a lot earlier before they start showing you obvious signs of pain, before they're reluctant to jump on the couch, before you've got extensive muscle wastage and muscle loss. So more subtle signs that you can look for. So difficulty or stiffness getting up out of bed, especially in the colder months like winter, being a little bit more reluctant to jump on and off the couch, in and out of the car, those sorts of signs. If you're patting your dog and you're finding that their muscles are twitching, or it almost looks like they're spasming, or they're looking at you when you touch a certain area, that could be an indicator of pain.
Right.
But I think with greyhounds, them coming from a background where they were essentially meant to hide everything behind the pain, they were there to race, and that's all people cared about. I think it's a lot harder for them to actually show signs of pain.
Right. So they didn't learn that sort of interactional vocabulary because they weren't really interacted with in any kind of socialization way.
That's the thing. I say to people, seeing a greyhound puppy, that's a unicorn. I've never actually seen that before, because us as the public, we don't see them in that state. We see them once they're been through the racing industry, that they're worn out, the trainers don't want them anymore, and they haven't had that life as a pet. It's absolutely tragic.
It is. It's not a life. You mentioned the bad breath is a sign. I think I'm doing a good job then, because me and my beautiful girl Bunny, we are constantly kissing each other. So I am
He's not lying.
I am constantly monitoring her health. That's the way I'm going to explain it.
You definitely know to smelly breath if she's giving you kisses.
Oh, we love kissing. Do you have any particular stories, any memorable sort of patients? Is there anything that comes to mind?
I've got a story, and it's potentially a little bit tragic, but I definitely think it's quite a good one for the audience to hear, because it's the reality of the greyhound industry. So I used to volunteer with a rescue in Melbourne called Gumtree Grey, so a fantastic greyhound rescue. And it was actually one of my first rescues. And we were called to pick up a dog from a trainer. Once we got to the home, this dog was absolutely emaciated. And what we were told that, this was quite sudden. None of this was noted before. And I thought, okay, this dog really doesn't look right at all. It's completely skin and bone. Its gums are a little bit pale. This is not a dog that this has happened to suddenly. There's something that's gone on for longer.
Right.
So what I ended up doing, got the dog in my car, drove to my own place of work, so the emergency hospital that I worked at. And after a fairly extensive diagnostic workup, we found really advanced lymphoma, so a type of cancer. And what we were told that this had just happened, absolutely not. This would have been happening for months and months. This was months of neglect, lack of any veterinary care. This dog's blood sugar was low. Its abdomen was just full of cancer. Its liver was having problems. It was such a tragic story. And unfortunately, with the cancer being that advanced, the decision was made to euthanize the dog based on welfare grounds, because there wasn't anything we could do for this dog. And this dog's name was Cosmo. He was an absolutely beautiful dog that didn't deserve to have this level of neglect. This is not something that happens overnight. This is months and months of complete lack of veterinary care, which unfortunately is a common denominator in the racing industry. And that infuriates me. It just got me really emotional. You might be able to hear it in my voice, but it's just, it's something that's unacceptable. And the fact that people can be okay with allowing dogs to suffer to this extent, where we're having to euthanize a dog because there's nothing else we can do, is just absolutely infuriating.
It's such an important point. So the focus when you treat greyhounds as commodities, I think that feeds into this lack of broader care. The teeth don't matter, not going to slow them down. So isn't it endemic then to an industry that sees beautiful creatures as commodities instead of companions? You don't have to join the dots too much further, do you?
Not at all. And I had another rescue that I was a part of where the trainer had agreed to, I think, give us 2 dogs. And we actually turned up to the facility, and the environment that the dogs were being kept in was absolutely atrocious. So they were kept in these concrete cement kennels. There was feces absolutely everywhere. And what was the most confronting is they're called bark muzzles. So they're essentially a muzzle that's wrapped around right in front of the nose, preventing the dog from barking, which means preventing the dog from opening its mouth, preventing a dog from panting. And panting is actually the only way a dog can effectively cool itself. Dogs don't have sweat glands. So panting is a life-saving measure. It's a coping mechanism, especially when dogs are kept outside in the heat. And these dogs were prevented from just basic animal rights of being able to pant, drink water. And it was just absolutely atrocious to see. But the difficult thing is if you go in gung-ho and say, what are you doing to these dogs? The trainers are not going to give you these dogs to the rescues. And who knows what happens behind closed doors. I think a lot of the time we do. But it's just a really sensitive area where you can't go in guns blazing as much as I would love to. It's a fine line between trying to get the dogs off the trainers and ensuring that we do that safely.
So you got to put the hounds first and deal with...
Exactly.
Yeah.
I know that in Western Australia, those muzzles are now banned. I think that's nationally now, or I would hope so.
I really hope so, because it's just, you're completely removing a dog's basic physiological right to just pant. That's insane. I didn't even know these things existed until I actually saw it. I thought, I've been a vet for a while, and the fact that this is the first time that I'm seeing this, I had never seen it before. I really had to bite my tongue when I was at the facility because I was fuming. It was awful.
Yeah. I think there's a lot of things that this industry have invented that shouldn't have ever been used for animals.
100%. I think that there was also a surgical insemination, which I think has recently been banned, where female dogs would surgically be inseminated. So they would do a surgery, they would cut into their abdomen, cut into their uterus, often with minimal pain relief. God knows what vets would be okay to do this. And thankfully, I think that and someone can correct me if I'm wrong, I think in the last couple of years that's been banned. But again, the fact that was even a practice that was still being done, which was an ancient, outdated thing, just is mind-blowing.
It hasn't actually been banned yet. It's due.
It hasn't? Oh, my goodness.
January 2026, and that's not in every state either. Wow. New South Wales is still fighting it, as far as I'm aware. I'm just not sure, who are these vets? Obviously, they're profiting, but you guys take an oath of some description to put the welfare of the dogs or the animal ahead of everything else. So I can't understand what... And I'm not asking you to respond to this at all, Olga. It's just it's this thing of why, because vets could really end this. If they refused to work on track and refused to do the work, then it would be shut down because they wouldn't be able to race without vets on track. So it's just another part of it.
I don't think you can call yourself a vet, an animal lover, if you're going to engage with those practices or be blind to what's going on working in the industry. I think that's deplorable. I think you can't call yourself a vet, an animal lover at all.
We had a vet nurse that worked at the track and speaks to us quite openly. And she said I think it was three years that she worked on the track, only one owner asked to take their dead greyhound home so that they could dispose of the dog itself. All the others, because obviously the dog gets put in the freezer if it's destroyed at the track. And then at a certain time they remove all the bodies and get rid of them. But only one trainer out of 3 years came and asked to take his dog home.
I think that speaks to something, doesn't it? Yeah. Olga, I know that you offer an online first aid course for companion pets. That sounds awesome to me, because I'm a really terrible doggy daddy. If Bunny steps on a twig and just winces, I'm just in the corner rocking, sucking my thumb. Gemma has to step in and manage things. I just can't handle her being in any pain. What are some of these essential skills someone like me should have to sort of handle emergencies with their greyhounds?
Yeah, so I think the reason why I put the course together was over the years I've had so many owners come to me and say, Could I have done something differently? Could I have recognized this problem earlier? And for me, that was enough to say, look, I need to put something together for owners to feel confident, because as an owner, you're often the first responder on the scene, and the decisions that you make in those couple of seconds, couple of minutes can actually be the difference between life and death or extensive hospitalization, lots of complications, versus you identified a problem quickly, you acted right away, and you got your dog the treatment that it needed. So I feel like it's not something that I see in the market that much, and that's why I put the course together. But what I cover is early recognition, prevention, and then also in the event of an emergency, exactly what to do. So I pretty much touch on all topics related to dogs and cats. So seizures, anaphylaxis, snake bites, cane toads, especially because we see a lot of them up here in Queensland, just to equip owners with the knowledge to recognize symptoms early. Because unlike people, a dog can't tell you what's happened. And that's the problem. You as an owner have to almost preventatively take that step and think, okay, something's happened, evaluate things from there, and then make the decision that you need to. So I've had some really good feedback from the course. I keep adding new modules. There's lots of things. I use Charlie, my senior greyhound, in a lot of the videos, especially he's so patient, which a lot of greyhounds are. So I use him as a demonstration for bandage care, tail bandages, especially greyhounds. They're gonna, I'm sure you guys would have heard of Get Happy Tail coming from kennels and all those sorts of things. Missy, our previous greyhound, we actually had to do a tail amputation because she was that happy of a dog that she broke her tail just wagging it. So
Wow.
lots of different sort of tips and techniques that I teach in that course. It doesn't replace the need for veterinary care, but you know that you've done everything in your power to give your pet the best chance possible. And you don't feel guilty. You don't feel that regret of what could I have done, or did I miss symptoms that sometimes they can be quite subtle. So if you've got that knowledge, and I think knowledge is power, it's just good to see owners starting to feel a lot more confident after they go through the course. So it makes me happy that I can provide that service.
I think I need to jump on and do that course, Olga, 100%. And we'll chuck the link up for that so people can visit the site and jump onto that course. It's been an absolute pleasure talking to you, Olga. I can't let you go without asking what your thoughts are on greyhound racing in particular. It's really heartening to hear you speak out in terms of vets can't really call themselves vets if they don't put the priorities of the hounds first. Just in general, what's your position on I've got a sneaking suspicion, but what are your thoughts on greyhound racing, the industry itself?
Yeah, absolutely should be banned. It's clear cut. It's an absolutely deplorable industry. It's abusing the dogs. There is absolutely no animal welfare, and we absolutely have to put a stop to this industry. I don't think I've ever seen a dog come from a trainer where they've been in good body condition, happy, healthy, accustomed to pet life. They come with a myriad of problems and the core root of this problem is the greyhound racing industry. So I think we absolutely need to put a stop to it.
Here, here.
Here, indeed.
Well said.
Awesome. It's been great to hear the voice of someone who works so closely with these hounds in a compassionate, healing, rehabilitating field. Please go and visit the online course. People, if they want to jump onto it, do you have the link we'll put on the Free the Hounds?
Yeah, so it's just my name, so drolgalynn.com.au, and it's got all the information about the course, all the topics that I cover. So it gives a really good description of exactly what's in there. And the course is lifetime access. So I wanted to give people the capacity to keep revisiting the information. Anytime I add new modules, you've all got access to that. So I'm making it a really in-depth course that's really user-friendly. So you don't have to have any medical background to do the course, but it's, just a really solid, comprehensive, easy to follow course, just for an owner to feel a lot more confident in looking after their pets.
I know what I'm doing tonight then. Brilliant.
And because we can see Charlie, if there's a greyhound to look at when you're watching it too, even better.
Yeah.
Yeah, there's greyhound videos, there's cavalier videos, and then there's some cats that are got a bit spicy with me, but it's okay.
Yeah, I've got 4 cats at home, and one is, we go through the whole gamut. One is super spicy. One is my dear old 17-year-old boy that's on his way out. And then we've got this little ginger ninja who's about one, another little rescue. He's sublime. He's such a gorgeous cat. And then we've got our little black crazy cat that thinks she's a greyhound, that adores our surviving greyhound.
I love it. I absolutely love it. Yeah, our 3 cats actually grew up with our 2 previous greyhounds. So
beautiful.
For them, as soon as they see a greyhound, that's why they were so it was a really easy transition for them to welcome Charlie into the family because they thought, okay, we've met this guy before. We love greyhounds, and they've got a beautiful friendship.
That's lovely, isn't it? And I think it gives each of them companionship too. Like a greyhound doesn't necessarily like being alone, especially if they've spent a lot of time in kennels. So even the cats, I think, are a companionship for them.
Definitely, yeah. The cats will actually groom Charlie some of the time.
Same with my cats. They stick one of them wears her ear like a gas mask. He puts his whole face in her ear.
Nice.
I love it.
Olga, did you have any final thoughts or anything that you sort of wanted to say to our legion of hound lovers before we wrap it up today?
I thought I'd just quickly mention just a condition that I think it's really important for greyhound owners to be aware of. It's a condition called hyperfibrinolysis, so a fancy way of saying a bleeding disorder. So greyhounds are particularly susceptible to this, and the reason that I want to make everyone aware of it is because anytime you've got a greyhound that's going to undergo a planned surgery, in Australia there are no specific tests that are available to check for this bleeding disorder. So what at the moment we're doing is making sure greyhounds are always put on medication leading up to any elective surgery. So it's always important, if you're a greyhound owner and you've got something booked in with your vets, have a chat with your vet. The medication is called tranexamic acid. It's something we use usually 3 days leading up to surgery to try and prevent any potential catastrophic bleeding at the time of surgery or after. So just something I thought I'd mention. There is a test that I think one of the universities in Washington overseas, they have recently released a test that actually screens for this genetic disorder. So don't think it's available in Australia as of yet. But yeah, greyhound owner, any planned surgery, make sure you chat to your vet about this bleeding disorder. And most vets will be quite aware of it. But yeah, just wanted to mention that quickly.
Wow, this has been such a wealth of information and knowledge and advice. Again, everyone, if you're listening, it's Dr. Olga Lynn, all one word, .com.au, and I'm guessing they can find some more about that there, Olga?
Yes, correct. Yep. I've got lots of articles on their blog posts, and I, in particular, talk about this bleeding disorder in greyhounds, so definitely worth having a look. And I've got lots of sort of information on my Instagram as well, where I talk through greyhound-related problems.
Mel, the people we talk to, honestly, they're just so smart and so passionate, and it's just lovely. Thank you so much. And thanks for sort of, I know you finished at 4 a.m. I think you said you're getting four hours sleep. We've just taken an hour of your sleep away, and I think you might have some time off coming up. Please relax and enjoy that time.
Yes, absolutely. It's been an absolute pleasure talking to you guys. This has been a lot of fun.
Thank you so much, and pats to the puppies and the cats.
Told you, Mel. What did I tell you about Dr. Olga?
She's brilliant.
Isn't she extraordinary?
Really nice lady. Absolutely. Yeah. And I'm going to do that course.
Me too. I'm going to jump on it. So I can
look at Charlie.
Yeah.
No. So I can take care of all my cats and dog.
Yeah. I'll do it. Should we have a little sleepover and we'll do the course together like we do sometimes? A little pyjama night together? No. Every now and then we get our milk and cookies and we'll sit and scroll through greyhound pages, and it's fun.
Yes.
You don't have to be ashamed, Will.
Okay.
All right.
All right.
Thanks, everyone, for listening. Come again next time. And, let's keep informing ourselves, keep being passionate, keep turning up to stuff so that we can one day release the hounds.